there are certain processes and protocols. You have to follow them. It is like, just an example I tell you. You have pilot sitting in the cockpit and you have air hostess. Does it mean that the flight can, taking off and then landing of the flight can be smooth, or it can be successful? They should know the process. And also they should follow and do the process properly. So ICU is all about teamwork. Okay, no one can be with the patient on the clock. No, even nurses, doctors, they need to have their own life. No one can work around the clock. So when there is shift change happening, when there is night coverage, night times, and then patient has to be given whole care, because patient on ventilator, for example, most of the times they are not conscious, they can't take care of themselves. So the feeding of the patient has to be calculated, and then a tube, from the mouth it goes into the stomach, and then feeding has to happen properly, and calories have to be calculated. Similarly, urine output. Similarly, whether patient has passed motion or not. How is the skin? Whether somewhere patient is developing, any problem, any ulcer, bed sore, things like that. So many things have to be checked. It's like a checklist, proper checklist. So nursing care, doctor care, paramedical care, diet related, physiotherapy for recovering patients, for patients with complicated scenarios where you need people to check the drugs, what drugs you are giving and their possible complications, interactions. So many things happen in ICU.